But my mother, who's 95 and is a graduate, and speaks six languages, was not allowed in her kitchen when she had her periods. I meet young Indian Americans who have never lived in India,
Mhm.
have been born and brought up in the USA, who follow the same rules in the
Wow.
US. So these traditions are so strong and so deeply embedded in us, in almost like in our DNA. So for me, the work I do in sexual health gives me a handle to challenge this.
Hello, everybody. My name is Michelle Melville Kashan. I'm the Community and Content Director here at Sexual Health Alliance. And today I'm with Dr. Chandra-Mouli. Dr. Chandra will be speaking at our online event, Cross Cultural Perspectives on Sexual Health. So, welcome, Chandra. Tell us about yourself and your time with the World Health Organization.
Thank you, Michelle. I'll do that with pleasure. I'm 66 years old. I was born and brought up in India. I left India soon after I completed my undergraduate medical training at the age of 24. I lived and worked in Zambia for 10 years, Zambia in southern Africa. I did clinical work for 5 years and then did public health work for the second part of my stay in that country, initially in childhood malnutrition and then in HIV. I'll talk about that. And I have now lived in Switzerland for just over 30 years. I still feel very closely connected to India at the personal level, but also professionally. But I'm, hugely shaped by all these places I've lived and worked in, 75 countries in all,
Wow.
and also my life experiences. My father died when I was 16. My mother, who's 95 and still going strong, raised us on her own, despite the fact that her parents were alive when her husband died, with the support of her family. And my first wife, whom I met in an inter-college competition in India at the YMCA, an inter-college competition which I organized. She was one of the sterling dance performers, developed non-Hodgkin's lymphoma and died at the age of 37 when I was 38 and our son was 8 years old. So after 10 years as a single parent, I remarried. My second wife is Swiss. She's of Spanish origin. She's a psychiatrist. And we have a daughter who's precious to us. She'll turn 18 this year, but Sarita lives with epilepsy. So all these life experiences have, of course, shaped me in profound ways. So, in terms of my education, I did my schooling and undergraduate medicine in India. I did my post graduation in public health in England, and I completed my PhD, my doctorate in sexuality education last year at the ripe old age of 65. So I am deeply grateful for both the small and big things that life has given me. I never imagined that I would be here in my life. And I would describe myself as a glass half full person, a person who sees a glass of water as half full, grateful that it is half full, eager to make it full with others, and then eager to get that full glass of water in the hands of someone who needs it desperately.
I love that.
So that is a little bit about who I am. I worked in WHO for 30 years. I joined WHO in 1993 at the age of 35 and retired in 2023 at the age of 65. An enormous privilege. I joined the Global Program on AIDS based on my work in Zambia, and then in the joint UN program on AIDS. I then moved to WHO to work on adolescent health, and for 27 years, I worked on adolescent health. in various departmental configurations. My work focused on adolescent health, but with a particular focus on sexual and reproductive health.
Yeah.
So that's been my big area of focus. It's been a privilege to work for WHO. WHO is hugely trusted. I said earlier that I've traveled and worked in 75 countries. And in every country, because your WHO doors open,
Right.
people expect you, of course, if you're white, they expect you to be good because you're white. If you're not white, you have to prove that you're good.
Yeah.
But when you come from WHO, doors open and there's much more willingness to give you the chance to say what you want to say. Decision makers want to hear our points of view. They want to use our guidelines. WHO stands for science. It is not scared to say what needs to be said. It's not intimidated by power or by money. And in these 30 years, I can honestly say that nobody told me not to say or do something. I talk about premarital sexual activity. I talk about having sex before I was married and going far away from home to a pharmacy to get condoms. And I've said that in meetings of ministers of health, including from ministers of health from the Southeast Asia region, a conservative region. I speak about masturbation. I often say I have a beautiful wife. We have a healthy sexual life, but I masturbate from time to time. How many of you do so? Raise your hands. And when only a handful of hands are raised, I say, I'm sure most of you do it, if not all. Right. But nobody has come and pulled me aside and said, this is not acceptable for WHO. So I'm proud of WHO, particularly in this context. I'm really proud of being part of WHO, which I always will be till the end of my time. And then WHO is not smug and full of itself. It makes mistakes like everyone else, and it accepts these mistakes. It doesn't accept it from a position of power. We are held accountable by ministers of health. We are held accountable by various bodies, and we acknowledge our shortcomings, acknowledge the mistakes we make, and learn from them, both from within the organization and from outside. It's quite interesting that you can actually say, I grew up in India, very hierarchical culture. Living and working in Switzerland, you can actually tell your boss, I'm not sure that I entirely agree with this. Of course, respectfully, but you can disagree. And that's wonderful. I can go on speaking about WHO. Could I just say a few more things, or
Yes,
do you want to go on to
absolutely.
other things?
No, let's talk a little more about WHO.
No, working with WHO has been rewarding at many levels, and I'm going to speak to 5 things. I have worked with and befriended knowledgeable, committed, hardworking people from around the world. There are different countries, different cultures, different sexes, and different sexual and gender orientations, different disciplines, different life experiences. But they are hugely powerful and wonderful group of colleagues and collaborators to have had the privilege to be part of. I've traveled and worked in 75 countries and learned from these people. It's so nice to, Michelle, you said you traveled to Mexico, you've traveled to Colombia, to Belize. One of the joys of working for WHO and for partners is you get off the, tourist track, you get invited into people's homes, you get invited into their lives, you meet their children, their spouses. For me, it's truly such a richness to have had this experience.
Yeah.
And one of the nice things in WHO is you're judged by your competence. Within 48 hours, within 72 hours, within a week, people know whether you're capable of something or not.
Yes.
They judge you by your ability to work with others and to deliver. They don't judge you by your skin color, your race, your sex, whether you're from a rich country or not, and whether you come from an Ivy League university or not. And the bottom line is, can you deliver?
Mhm.
When you're given a document to review, do you come up with sensible points? Can you do that quickly? Can you say the points you want to say in ways that can open doors, not close them? That's the issue. And WHO has challenged me to grow. I joined WHO when there was no email. We still were working with faxes and telexes. And over the years, I worked with LinkedIn. My son teaches me these things with his eyes rolling. But, I've learned to work with, keep up with the latest developments, working with Chat GPT now. You learn as you go. And you learn that, these are tools, just like a screwdriver or a pliers, yeah, and you can use them. And, it doesn't take a lot, takes some effort, but it's not more difficult than learning to read or write. I mean, or learning to read or write other languages. I've learned Spanish, I learned French. I work in all these languages. I learned Chibemba in Zambia, where I lived. And so I find languages more difficult than working digitally. But, it's a privilege when you speak a language even badly. It demonstrates respect and it opens doors that simply speaking English doesn't. And I've learned technical abilities. I joined as a medical doctor with some public health training. Now I do the whole spectrum of all the public health functions, from generating evidence to making sure that it's applied and used. So, it's challenged me to grow. And, the fact that I've done my PhD at the age of 65 is just demonstrates that, it's a learning culture. And finally, I've experienced WHO as a caring organization. 18 months after I joined WHO, my first wife was diagnosed with cancer. I was not bumped off. I was treated with respect and empathy and support. And 20 years after I joined WHO, my daughter was diagnosed with epilepsy. Um, Focal cortical dysplasia, medicine-resistant epilepsy. And again, I was treated with the same empathy and respect. So I feel enormously blessed. I'm Hindu. In our tradition, we think about good things we have done in our past lives to benefit from all these huge blessings. So, I feel very blessed at many levels.
Well, thank you for sharing all of that. I think it's fascinating, and I love hearing about your career with the World Health Organization, as well as your personal experiences too. So, can you tell me a little bit about what inspired you to dedicate your work to adolescent sexual health, and how has your perspective evolved over the years?
I don't like the word dedicated very much. It's almost as if, I've done something out of charity for someone. For me, this has been a ball. This has been fun. And, I have done this work and I continue to do it after I retired on a no payment basis. I get a good pension. So I decided to work without money. So what inspired me? Between 1983 and 87 in Zambia, I did clinical work. And I saw a lot of patients with sexually transmitted infections. And, I would talk to them about STIs and condoms and, bringing their partners in and avoiding infections. But, the same patient would come in 2 weeks and say, Doc, I went shopping and got lost. And, it was almost as if, this is part of life. And I felt I needed to do something. And then the agency I was working for, the Norwegian Agency for Development, offered me an opportunity to work on HIV prevention in 87, 88. So that kind of provided a logical next step to the work I've done. So that kind of clearly, that was my pathway. And again, as I said to you, when when you travel with colleagues from WHO and sit down waiting for a flight or, waiting for a meeting to start, you see that everybody is coming with different pathways. Another important influence in my work was menstruation. I see menstrual health as a very important issue, and I'm very proud of having placed this in, anchored this in WHO's agenda. I used to run workshops on adolescent health around the world. And one of the first exercises that we would do was ask people to reflect on one experience from their adolescence, which is kind of etched on their minds. And to put that experience face down on a card and face down on a table anonymously. We would collect the cards and then look at them. And always, wherever I ran these workshops, whether it was Argentina or, Mongolia or Papua New Guinea or China or Nepal, the answers, there were always 4 or 5, sometimes more, sometimes less cards saying menstruation or period pains or mocked when I had my periods. And as I learned from these women who were in their 30s, 40s, 50s, giggling in the classroom, made to wait in the staff room, and then the mother or the aunt or the often a female relative coming with a towel or a bed sheet and wrapping her around, looking as if there'd been a death in the family and taking her home and saying, from today, you can't play with the boys. And my own experience was I grew up in a highly educated family. My paternal grandfather has a PhD from Wisconsin University, highly educated family. But my mother, who's 95 and is a graduate, and speaks 6 languages, was not allowed in her kitchen when she had her periods. I meet young Indian Americans who have never lived in India, have been born and brought up in the USA, who follow the same rules in the US. So these traditions are so strong and so deeply embedded in us, in almost like in our DNA. So for me, the work I do in sexual health gives me a handle to challenge this.
Yes.
And my personal experiences too, Michelle. I received no sexuality education at home. I still can remember the face of my biology teacher, with this sexual and reproductive health, what was it called? The sexual and reproductive system or reproductive system. It wasn't called sexual and reproductive system. So, humming and hawing and blushing and, uncomfortable silence and then saying, you can read this chapter at home. There'll be no questions about it in the exam.
Wow.
So, my own experience of lack of sexuality education, my own experience of, going out to find condoms influenced this choice. So, to sum up, clearly the inclination was there and I had the opportunity. And then the opportunity that's kind of grew from one into another. And then, you realize one fine day that you're in a powerful organization, you have huge leverage, and, you're taken seriously when you speak. And as you grow older, there are fewer people who can shut you down. And you say what you need to say. So this is such an enormous privilege. And as I said to you, in an organization which gives you the space to do what you want to do. Of course, there are checks and balances, but once they see that you know what you're talking about, that you work in a measured way, you follow the rules, then they give you the space to do what you need to do and to make mistakes if you need to make mistakes.
Well, speaking of sex education, so how do you think sex education in the United States compares to some other countries?
The US, like India, is a huge country. And, you can, you know, do averages, but averages don't do justice to people on the two ends of the spectrum.
Yeah.
I think there's some great research in your country. Doug Kirby, is one of the gurus of sexuality education who influenced and shaped all our work many years ago. I think the bottom line for me is a seeker's scorecard. And what it says in the latest scorecard is sexuality education in the USA is a patchwork of state and local policies resulting in significant disparities in the quality and comprehensiveness of sexual health information that young people can get. And, finally, it boils down to the zip code in which you live.
Absolutely.
And for me, that is entirely unacceptable. You can't have, one county which does extremely well. And, I speak to a lot of students, and I know even in a classroom with 20 students from different parts of the USA, you go around the room and you ask them what information they got. And it's incredible, the diversity.
Yes.
It's incredible. So for me, it's a terrible situation. And last year, I was in the Society for Adolescent Health and Medicine meeting in San Diego, and I came away very worried, because we hear a lot about the backlash on abortion. We don't hear so much about sexuality education and contraception. In the blog piece that I've just published, I've described that. But I think the situation we have with sexuality education is in some ways no different from the situation in abortion. Everything comes down to state policies or county level policies, and in sexuality education, school health policies. It's the school health board which decides what is allowed. And if you have a bunch of people who have been pushed in there with money from a right-wing group, they can block anything that the majority wants to do. And for me, this is madness. This is absolute madness. Can I go on? Can I?
Yeah, absolutely.
I'm not, from sitting here in Europe, when you see the discourse on gun control, it's very hard to understand. But it's no different from the discourse on contraception. There are strategies. These strategies have worked elsewhere, but people don't want to hear them. I studied in London in 88, 89. We went there when our son was 1 year old. We had a health visitor come to our house within 3 days of our coming to check whether the baby was safe and getting the right nutrition in this new environment. We could get treatment from a pediatrician. And when I took the prescription to a pharmacy, I realized that because I was a resident in the country, the medicine was free of charge. Incredible.
Wow.
Incredible stuff. But there was an agreement that, everybody who's legally resident in this country gets the same level of care. We took our daughter, and I told you she has, focal cortical dysplasia, to Cleveland Clinic. Cleveland Clinic is one of the premier pediatric epilepsy centers in the world. So I'm Indian. My wife is Swiss, but of Spanish origin. Our daughter has a Swiss passport. We have money paid for by WHO's insurance. We could get the best epilepsy surgery care. The driver of the bus, who's American, whose grandfather is American, didn't have access to the same level of care. This for me is unacceptable. So, you have to see the lack of access to sexuality education in the broader context of the lack of willingness to accept, widely accepted approaches to public health and well-being and to equity.
Right. And that's the thing. We have examples of countries who are doing it well, and providing access to healthcare services, and we're just ignoring those examples. We're not following them.
And examples from within your own country. For me, what can you do with this? I think, you have, for me, that there are states in which you have supportive policies. I think these states should deliver sexuality education, demonstrate results, publish them. I don't see them in the literature. Maybe I'm not seeing them in the right places, but I read articles about the terrible state of sexuality education in Texas. But I'd love to see more papers published in the peer-reviewed literature on good quality examples, good quality programs in places, because once you have a body of experiences from a number of states, it becomes harder to deny them and to ignore them.
Right.
And in states where there are no supportive policies, still work can be done. In this webinar you're organizing, we're going to have presentations from Lebanon, presentations from the Philippines. And, for me, an excellent example is Pakistan. In an Islamic country, in a country where there is, a large and reasonable majority and a, vocal and, fundamentalist minority, NGOs have found a way to work around and deliver sexuality education, even if they don't call it that, in public and private schools, for girls and boys, in Muslim religious schools. It's possible. It's possible to build community support, parental support, and move forward. It's possible to use hooks. One of my great heroes in this field is a woman called Sheena Hadi. She is from Pakistan. She's a Muslim. She's a wife. She's a mother. She's a sexuality educator. And she has brought community support by demystifying it and talking about things that parents can understand and relate to. And she uses hooks, like when there was a terrible, brutal rape of a small girl in one of the provinces of Pakistan. She used that as an example to say, if your daughters and your sons had been educated about these issues, they would have known how to at least ask for help.
Yes.
So I think there are many lessons to learn from other countries, and I hope this webinar will provide a forum for that. I think, there is, in this context of pushing back science and pushing back institutions, which have, worldwide reputation, such as the CDC and USAID, I think that, there's still work that can be done, as many other countries have done. What you're going through in the US is new to you. It's not new to so many other parts of the world. And it can be paralyzing. It can be hugely intimidating. But there are ways of coming together and supporting each other, as you all have done with as gay people did in San Francisco at the start of the AIDS epidemic. One of the first lessons I learned in my work was from the Terence Higgins Trust in London. I was studying in London. I used the opportunity to network. I went and visited the Terence Higgins Trust, and I learned about the work that was being done in London, and through them about the gay men's health crisis and all the work. But, this was a climate when there was a lot of stigma attached to being gay, a lot of stigma around HIV, not enough science. People knew, and the gay men's health crisis and their group, they developed public health strategies even before the virus was discovered. Yeah. So I think there is a precedent from HIV that, we have learned from your country. And I think there's much that can be learned from them.
Yes. So if you had to say, if there's a country out there that's like the gold standard of sex education, somebody that the US can look upon and say, like, wow, they're really doing a great job, we could take notes from them. Do you have an idea of who that would be?
Yes, I could give you examples, but there's no point in comparing the US with Germany. There's no point. Why? Because in Germany, there is a consensus, and there's been a consensus for over half a century that young people need to be prepared with sexuality education. That's true in many European countries, in the Netherlands, in France, in Switzerland, in Sweden, in Norway, in Denmark. Um, and so, school based sexuality education is in place. It is in place as a rights based approach, not as a tell these young people about all these problems and to stop having sex.
Mhm.
No, it says that you're a sexual being. And just like you need to know how to cross the road safely, you need to know about sex and reproduction and sexual health. And the evidence from all these countries, they have large scale, nationwide representative surveys every 5 years. And the data is, striking. Over time, people have sex later. When they have sex, it is protected. There's been a decline in contraceptive use in the last a couple of years, largely because of influencers who are telling young women that putting contraceptives into your bodies is bad and things like that. But overall, the trend is increase in contraceptive use, increase in contraceptive use in first intercourse, and most importantly, in the latest study from Germany, um, most people who had sex prepared for it. They knew they were going to have it. It was not a surprise. And most of them recall their first sexual encounter as pleasurable. No surprises, well prepared, and well prepared with information, and in a wider climate where sexuality is accepted as norm. So Germany is a very good example. Switzerland, where I've lived for the last 30 years, is an outstanding example. My son was 8 when his mother died. Like I said, he was 5 when we came here. And in the school, they have a series of sexuality education programs, age and developmentally appropriate. Starts with information sharing and then graduates into other things. And, often in the beginning, we would be told as parents, this week we're going to have this session and we're going to address these issues. If there are questions you have, come and talk to us. If your children have questions, this is some information to answer. So, good quality sexuality education and no option to withdraw your children from these classes. This is, obligatory as part of education for all. Most importantly, my daughter, who goes to a special needs school, gets exactly the same education that her brother did in school for children without special needs. The Swiss government recognizes that people with intellectual challenges are sexual beings and, in fact, are even more vulnerable to being coerced into having sex than others who don't have these intellectual challenges. So, there are tons of examples like this, but I don't think Germany and Switzerland are good examples for the USA. I think Pakistan is a better example for many states about what is possible to do in a climate where any discussion on LGBTQI plus issues can get you in front of a firing squad, in inverted commas, or where any discussion on these issues is not possible. Even there, something can be done. I think you have to think of the USA as different states with very different climates and different examples to follow from different parts of the world. no one size fits all for this large and diverse and complex country. When storybooks are being taken out of libraries because they contain things that children are not supposed to read, that level of madness probably exists in Afghanistan. I don't see that in so many other places.
And that's so well said. And we should be looking, like you had mentioned earlier, we are like a patchwork, because we have so many different regions with different values, and every state is so different from the one.
Every school is so different. Zip code, I know from many friends and relatives in the US that people go and live in a particular area because the schools in that area are good. Shocking for people in Switzerland.
Really?
The public school system is fantastic. You're obliged to go to the school in the commune in which you live, and the schools are excellent. This is the richest country in the world, and it's getting so many important things wrong.
I agree.
But I don't want to be judgmental. I empathize with people like you, like so many other champions, and what people like me from the outside can only say is we respect you for the battles you are fighting, and we are there with you morally and in every other way that we can.
And that support means so much. I've talked to a lot of people from different countries, especially in preparation for this event, and I have been getting an outpouring of love and support, and positivity and hope from other people, which is just so wonderful.
Yeah.
All right. So I want to move on to my next question for you. So reflecting on your 30 years with the World Health Organization, what are some things you consider to be your most significant achievements?
I want to step back. I think you have to see these things in a bigger perspective. 25 years now into this century, the world of adolescence has changed enormously. Yeah. Today's adolescents are much more likely to finish school, much more likely to be connected to the wider world digitally. Much more likely to grow up in families where their parents and grandparents live longer. And before the COVID-19 pandemic came, to be living in families which are less poor than even 10 years ago. Yeah. Sadly, the COVID-19 pandemic has resulted in a cost of living crisis in many places. As are these horrific wars in Gaza, in Ukraine, in Sudan, and DRC. Climate crises too. But, overall, through these 25 years, adolescent health in the areas that we are focused on as a world has improved. Fewer girls get married as children. Fewer girls experience female genital mutilation. Adolescent pregnancy rates are declining. Adolescent contraceptive use is rising. Adolescent maternal health care use is rising. HIV deaths are declining. HIV infection is declining, even in the poorest countries of the world. So in all these areas, there's progress. And I feel enormously privileged to have contributed to this in a small way with countless others. So, I'm very proud of the progress the world has made in these areas. There's unfinished business in these areas. There's a lot of work to be done in areas such as other sexually transmitted infections, intimate partner violence, mental health, substance use, the growing obesity crisis. There's a lot of work. But in the areas the world has worked on for 25 years, there's been progress. Yeah. And, I feel privileged to have contributed to it in a small way. At the personal level, I can take, rest on my laurels on three things. One is I have contributed to changing the discourse on adolescent health from we don't really understand it. This is difficult to do. We can't achieve change, to saying bullshit.
Yeah.
Yes, we can. Yes, we have. And the poorest countries of the world have done that. So, no one can now say that we can't. We can. If you want to reduce adolescent pregnancy, this is not a guessing game. There is science, there is experience. It's about political commitment. It's about translating that commitment into good programs. So that discourse has changed. Another thing I'm really proud about is the ground rules for the meaningful engagement of young people in our work. No substantive area of work on adolescent health is done in WHO without young people.
Mhm.
We select them openly. We agree with them on the tasks that they're going to deliver. We support them to deliver their tasks. We pay them for their time, and we fully acknowledge their contributions. We published a Journal of Adolescent Health supplement in 2019. Several of the authors didn't have a first degree. The journal asked, what are their qualifications? In university.
Yeah.
They've completed school. And I'm proud of that. This is something that, we have done. We had the ability to do. And I'm proud to, have anchored sexuality education in WHO. This is no longer something that UNESCO does or NGOs out there like Planned Parenthood do. This is very much part of WHO's agenda, all the way from research through development of tools to advocacy to supporting countries and to standing up to backlash when it occurs. The Institute for Research and Evaluation from Utah, one of your great states, has been putting out a series of reports, misinforming the world with, cleverly crafted reports which are entirely wrong technically about sexuality education, saying that it is ineffective and unproven. And we have stood up to this misinformation with articles saying that this was bad science and delivered in bad faith. So, this is WHO. So WHO does cutting edge work in tuberculosis, in malaria, but also in sexuality.
All right. So before we go, we love to leave our audience with a takeaway or a tip. And I love to hear your glass half full energy here. So, what advice would you give to professionals in the sexual health space who want to make a meaningful impact in global sexual health care or sex education?
This is what I tell the young people I work with. Many bright people come to WHO and do an internship and do a small assignment, and they ask, should we stay? And I say, no. Go out into the field. Go out into the field and work there for 10 years, work there for 15 years. There's nothing to replace, sitting on the ground and, talking to others and working with others and, making mistakes, making small mistakes, and being humble, being part of a team. So I think the first thing is to work and learn from others, learn from read. When I was in Zambia, it was so hard to get literature. Now you can Google stuff.
Yeah.
And you can learn, even if all these wonderful databases in the US are blocked, and I hope they won't be blocked for too long, you can get access to information. So learn about what people are doing around you, learn about what people are doing across the world. One of my great heroes from whom I've learned a lot is Stephen Covey. 7 Habits of Highly Effective People. One of his frameworks is a circle of concern and a circle of influence. I agonize about the war in Gaza, about what is happening in Ukraine, about the war in Sudan that no one talks about, about the war that so many women in India, my country, have to experience every day at home with intimate partner violence. I agonize about those things. but I focus my energy on the things that I can do and small things. And over time, these small things become big things. When I joined WHO, three departments worked on adolescent health. When I left WHO, 17 departments were working on adolescent health. Did I contribute to that on my own? No. But our work on sexual health made other departments see that there was a place for this, there was money for this, and that investing in this area could make a difference. You know, I trusted my instincts. I went with what I needed to do. But you know, the what I would tell people also is find people you can trust. You know, there are parts of WHO where if I made a mistake from the field and came back, I would never tell anyone because I wouldn't trust them about using this information to hurt me. But there were other departments and many other departments, the majority, or teams within departments where I could come and say, I messed up. And where I would be heard and supported and encouraged to go back and do something different. So how do you create, healthy communities of people whom you trust, whom you like, in the midst of this madness is the way to go forward. And I think there are good people in the world. There are good people everywhere, caring people everywhere. Our challenge is to find them and connect with them and nurture them and help them nurture us.
I love that. That's such a positive and helpful takeaway. Thank you.
Thank you, Michelle. Namaste and thank you. It's been a privilege to meet you. You are lovely. And I'm grateful to you for giving me the opportunity to bring people from Ghana and Lebanon and Moldova and India and the Philippines and possibly Uruguay into this meeting. All their cultures and their countries are very different, but I think they all have something to share and we can learn from each other through this experience.
Absolutely. And I am so excited for this event. So for anyone watching who wants to get tickets, we have tickets online at sexualhealthalliance.com. Something a lot of people don't know about, and I'm just going to mention it here. Sexual Health Alliance gives away 2 to 3 BIPOC scholarships for every online event. So if you are part of the BIPOC community or you're from another country and you want to attend this event and there's an issue with the price, you can apply for one of our scholarships so that you can attend at no cost. And we would love to have you there. The event happens on March 15th and 16th, 2025. If for any reason you can't attend live, you can always purchase a recording and watch the event later. This is something you're not going to want to miss. Obviously, we have a lot of great speakers. We're going to be sharing tons of knowledge at this event. So visit sexualhealthalliance.com. Also, if you like this type of content, please like this video and subscribe to our channel at Sexual Health Alliance. And thank you again, Dr. Chandra, for being with me today.
Thank you, Michelle. Lots of love.
Thank you.